Tom Leipold, the Executive Director of PEGTV, and I just want to welcome everyone to our live call-in. This is our third installment of a COVID-19 update, and I just want everybody to know that PEGTV is here doing as much as we can to put people's minds at ease. I'm working today with my colleague and friend, Jaye from Catamount Radio. Catamount is also co-sponsoring this event. So I just encourage you, if you have any questions about COVID-19 and anything you wanted to ask, we are live right now. So please call 747-0151. And with that, I'd like to turn it over to Jaye, WJJR Radio. Thank you.
Tom, thanks for hosting this event and the 5 stations of Catamount Radio teaming up with PEGTV. It's that important. These guys are very busy. Dr. Rick Hildebrant, the Director of Hospital Medicine at Rutland Regional Medical Center and President and CEO of RRMC, Claudio, they've taken time out of their busy day to give us a coronavirus update, COVID-19. This is our third go-round for this, and we're taking your questions live on the air and on cablecast today. So here is the phone number, 747-0151, 747-0151, and call with the questions that you need to ask. And I'm going to start with a question right away. The governor's stay-at-home order is now extended to May 15th, gentlemen. How is that impacting us in this area?
So, Terry, thank you, and I want to again thank Catamount Radio and PEGTV for helping us get this critical information out to our community. So the governor's stay-at-home order, I think it's certainly challenging to think we have another month ahead of us of staying at home, but I firmly think that it's everything that I've heard, it's the right thing to do. The hard work that Vermonters have been doing has really paid off in that we are seeing a flattening of the curve. And I think hospital operations, obviously we're operating at a different capacity during this time, but we are already starting to look towards the future about kind of the reconstruction period and what we need to do to ramp up our operations. But I think right now we continue to stay the course.
What about equipment? Personal protective equipment. We all hear about hospitals across the country. We're seeing these stories that are heart-wrenching. Are we going through anything like that at RRMC?
Yeah, Terry, fortunately not, for several reasons. Number one is I think Dr. Hildebrant and some of our other clinical leaders very early on put in a system of conservation. They looked at and investigated CDC guidelines, other best practices, and we started conserving our PPE early on so that we would have it for when we needed it. I think the second piece is our supply chain folks and our logistics section at the hospital. Were very proactive. Early on, when this thing started developing, they started going out and trying to source and acquire PPE to make sure our staff had enough. And then the final thing is we had some great response from our community, especially a couple of our large businesses, John Casella from Casella Waste Management, Paul Gallo from Magic Brush Painters, had a stock of PPE, the N95 masks, that they donated to the hospital early on. So I think all those three things, the community support, our foresight from our supply chain leaders, and some really smart clinical judgment on how we do this so far, and obviously the big thing is we have not seen the spike that we had feared. So we've seen a flattening of the curve and we haven't seen this huge influx of cases yet, but that could still happen, so we're still vigilant.
If you guys are ready, let's take a call. And by the way, if you want to call, we have a line open right now, 747-0151, 747-0151. And good afternoon. Do you have a question?
Yes, I do. I have a question in regard to testing. Where did I put that? The new Abbott ID Now COVID-19 test, the test that delivers a positive result in 5 minutes or a negative in 13 minutes. I know that they're making 50,000 a day, or they say so on TV. Does Vermont have this? And also, and if we do, does Rutland Regional Medical Center have this? Yes.
All right, thank you for your call. We're going to hang up and let them respond.
Sure.
Okay, thank you very much.
So testing for COVID-19, the most common test you'll hear about is a PCR-based test, which is a DNA test that is generally run at a reference laboratory. Local facilities do have capacity to run DNA type tests, but not for every type of DNA test out there. It requires very specific protocols to have the ability to run these tests. And not only that, it requires extensive testing. So we have a fair amount of equipment at RRMC that can run a variety of tests, and DNA tests included in that. And we have recently acquired the protocols and the appropriate supplies to develop the test at RRMC. It takes a fair amount of time to validate the test, however. So even when you have the capability to run it, you have to make sure that the testing protocol gives you accurate information. So our lab has been working very, very hard on this from the very beginning to not only acquire the appropriate testing material, but to validate the test. And we're very hopeful by the end of this month we will be able to run tests locally at RRMC. It's not the sort of 5-minute turnaround test, but it's within about an hour or 2 hours that we can find out information for tests to be available. So we're very hopeful that by the end of this month we will have capability at our facility to run those tests in-house.
Thank you for your call, 747-0151. And good afternoon. You're on the COVID-19 seminar. What's your question, please?
My question concerns elective surgery, and I had a scheduled hip replacement scheduled for June 1st, and it was canceled. I have a sister in Colorado who had a torn rotator cuff surgery for March that was canceled, and she, however, just did have her surgery yesterday. So I was wondering if RRMC had any timeline for reinstating elective surgeries, and if so, how are they being prioritized? And I want to thank everyone for taking my call and for hosting.
Thank you for your call.
No, it's an important question. We are actually working on that right now, when we can safely ramp up and do some elective surgeries. Now, we are doing surgery at RRMC, and we are doing some of the urgent or emergent cases and getting those done. And so we have a team that we've assembled to start looking at this, led by our Chief Medical Director, Dr. Boynton, about how we can start getting those surgeries back in the queue, how we can start doing those safely. Some of them depend upon some of the resources at the hospital. Do we have enough negative pressure rooms? Do we have enough PPE, which we do at this point? And can we test people in advance of the surgery to make sure it's safe to do that? So there's a lot of work being done that. I do not have a specific answer of when we can do that, but I will assure you that we are looking at that, and our clinical team and Dr. Boynton are looking at how we can ramp that back up and when we can do that safely.
It's a COVID-19 update on PEGTV and Catamount Radio. CEO and President Claudio is here, Director of Hospital Medicine, Dr. Rick Hildebrant, and your phone calls, and 747-0151. 747-0151. Good afternoon. Do you have a question?
Yes, I do.
Go right ahead.
How will we know it is safe to stop social distancing?
It's a great question.
Oh, yeah.
Great question. So one of the things that we've been looking at for a long time now is data models on how this disease has affected not only Vermont, but the entire country. And there's a lot of really smart epidemiologists and statisticians that have been looking at this question to try and come up with some answers. The answer is not the same in every single state. And there's some really good websites, and for those of you who have interest in looking at these kind of data, healthdata.org is a really good website. It does modeling, looking at specific pieces of information, not only number of tests that have been done and returned positive, but also some of the measures that we've put into place to try and minimize the effect that this has had on our population. So the mandatory stay-at-home order, the closing of non-essential services, and the educational facilities being closed, those have had big impacts on the states who have implemented those orders and have flattened the curve. We've seen that very much so in Vermont. And based on the data models we're looking at, it looks as though we're past the peak, which is really good news. If we continue to do what we're doing, all the social distancing that we've been doing, keeping vigilant with this, we think we're on the tail end of this, and we've got about a month left of cases, which is why, one of the reasons why the government has selected a month from now as sort of the extension of these mandates. We don't really know, but that is what the data models are suggesting. It's really important, however, that we stay vigilant through that time, because if we don't, if we slip up, if we stop doing the things that we've been doing, we could very easily see a secondary peak and a larger influx of cases. So while we don't know for sure, the current data model are looking as though about a month of a tail, and then we'll be most of the way through this. It's really important for us to be as vigilant as we have so far for the next month, however.
We got a call before we went on the air. They didn't want to go on the air. Here's their question. Where can people with sensitive skin get gloves? Do you know anything about where we can get gloves, or what kind of gloves do you suggest?
That's a really good question. I'm not sure that I'm the best guy to ask about where to get gloves, because I generally get my gloves from the hospital. However, I would say that while wearing appropriate protective equipment is important, I would focus more on masks than I would on gloves, and really practice good hand hygiene. That's the best thing you can really do to prevent yourself from contracting this illness. Wearing gloves and then touching something that's dirty and then touching your T-zone, your sort of mouth, nose, or eyes, can still infect you. The disease does not penetrate your skin of your hands to get you infected. It really is when you touch something infected and then touch your face. So I would recommend washing your hands. That's really a much better recommendation than wearing gloves around the clock. And then, as we have for the last several weeks now, wearing masks when in public is another great way to prevent an illness that you could have to go to others. These masks are really designed, the surgical masks, we think of them as surgeons and nurses using in the operating room. They're not using them to prevent illnesses that a patient has to go to the surgeon. It's to prevent what the surgeon has to go to the patient. And that's what masks do. If we all wear masks, then people who are sick with this illness will prevent it from getting it to others. So wearing a mask when you're out in public so you're not spreading germs, and washing your hands is really the best recommendation I would have.
I'm going to hide my hands now. But I do know how to take them off. Maybe I'll illustrate that. All right, we have another call, and your calls are important today. 747-0151. And go ahead with your question, please. Thank you for your call.
Thank you. My question was, when and how will the hospital decide to open and then close the alternative care site? And I also wanted to say thank you to all the hard work all the people at the hospital have been doing.
Amen to that.
Yeah, so that's a great question. We don't have a full answer. We are working in collaboration with the state of Vermont on that, and I think we'll probably have those staged up at least through the end of May is my initial thought, and then we'll kind of play it by ear, see how the curve and the data in Vermont is going, see what the state of Vermont Emergency Management and the Department of Health recommend. But we've very capably, the staff at the hospital, along with a lot of cooperation from a lot of community partners, have staged up, including Dr. Lisa Hogenkamp, Dr. Brad Berryhill, the Vermont VNA and Hospice of the Southwest region. As far as staffing, we have two sites actually, one in Mendon for COVID positive patients of housing, which we could house up to 40 patients, and then the Spartan Arena, which is designated for COVID negative patients of up to 100. Again, we're not out of the woods yet, and if we had a nursing home or a correctional institute get compromised, we could have a spike very quickly, so we need to keep those up and running and staged available. But I think probably by the end of May, we should have be able to look at when we can ramp those down, hopefully.
Another question, a lot of doctors, medical professionals are doing telepractice. online, basically online house calls. People in their house, they don't want to leave their house. We can do this. How effective are they? How do they work?
So I think what I'm hearing from our docs is that they're working pretty well, and they're ramping up their volume, and they're becoming more adept at how to do that. Now, a televisit isn't appropriate for everybody. They're identifying there are some patients that need to still come in and be seen physically by the physician. But for a lot of them, they can do it over telemedicine. Sometimes it's just a phone call, a simple phone call. You can have that conversation with your doc. And then sometimes it's actually a video face-to-face visit using some very common, easy to download apps that you can do that are secure and can have that. And Dr. Hildebrant also provides some support for our, he is our Chief Medical Information Officer as well as overseeing the hospitals program. Do you have anything else on that, Rick?
One of the positives, so there's so many bad things that have come out of this time, and there are some positives, however, and one of them is around telemedicine. So telemedicine isn't anything new. It's been around for a long time. However, medicine as a whole, especially small community hospitals, have been reluctant to adhere or to adopt this technology. And we've all sort of been forced, right? Our hands have been forced. We have the social distancing. We're trying to protect our communities, and we've broadly adopted telemedicine. And in many ways, that's a great thing. It allows us to reach patients in a different way and at a different level than we've been able to do before. And it's one of those things that is really just a wonderful thing to see. I was talking with one of our cardiologists earlier today, and they're seeing over 200 patients in a week with telemedicine visits. It's really astounding how we've been able to ramp this up in such a short period of time. That's not going to go away. We've now adopted this, and this will be a tool that we can now use for our community in the future. And I think that's really a wonderful thing that has come out of this, that we've now got some new availability of ways to connect with our patients.
And I do know that the community health physicians have been ahead of the game on this. I know up to a year ago they were very excited, and they had already put in place some of the capabilities to conduct telemedicine visits, and that is really paying off, and they're seeing a great adoption of that as well, from what I hear.
Agree.
We were talking about masks a moment ago. Governor suggesting that we wear masks. Dr. Hildebrant just mentioned wearing masks. Where do we get a mask?
So another great question. The supplies of what we call personal protective equipment, PPE, was initially quite limited. We did not have the availability to buy a lot of the PPE we typically would stock, the N95 respirators or the surgical masks. Thankfully, that has changed. Okay, the supply chain for many of these things has improved over time. The other thing is there's a lot of our community members that have started making cloth masks, which is really just a wonderful outpouring of support from our community, and we really do appreciate that. And I know a lot of folks I see either in the grocery store, around the hospital, or in the community wearing cloth masks, and that's a great thing to use as well. So if you can't find the paper masks, the surgical masks that medical professionals often wear, but you can acquire a cloth mask either from a community member or make one yourself, I would encourage you to do that.
All right, we're taking your calls this afternoon. 747-0151, 747-0151. Thank you for your call, and go ahead, please.
All right. Thank you, Terry, for what you guys doing on Catamount Radio. My question is, what is the status of the health of our senior citizen centers or nursing homes? How are we holding up? And a personal shout-out to Tom Rounds and his outstanding staff in the emergency center. Once again, thank you to all.
You're very welcome. Thank you.
So we've been really, really lucky. We have not seen the outbreaks that other communities have seen in our extended care facilities. And that is in large part due to great leadership and foresight on the part of the folks who are at these organizations. They instituted visitor restrictions early. They took care of their patients to make sure they're not having people enter or exit the building very, very early on. We have been in near constant communication with all of the leadership of the nursing facilities to make sure that we're continuing to provide care that is needed in those facilities while protecting the residents there. When patients are transferred from a hospital to a nursing facility, we go through extraordinary measures to make sure we're not sending someone that could have COVID, because in those types of facilities, it can spread rapidly. They've developed isolation protocols and testing algorithms within the facilities to really do an excellent job identifying people with symptoms, testing them and isolating them. And we haven't seen what has been seen in other communities as a result.
Thank you for your calls today, and we're going to go to line 3. Thank you for waiting. What's your question, please?
I have a question regarding the virus. How long does it survive outside of the human body, like on groceries, if somebody touches it that has it, or coming down with it?
Yeah.
That's basically what I'm looking for, is some type of answer. Everybody's talking about wearing masks, but nobody's talking about how long the virus actually lasts on DNA objects, mail, that kind of stuff.
Thank you so much. Hang on, please.
Great question. So early on in the illness, they've done some studies specifically looking at that. So they studied the virus as it is placed on a material and then saw how long it lives. Turns out that it lives for a different period of time depending on the surface that it's on. And it lasts the longest on stainless steel for whatever reason, and shorter on other materials. For paper, which is a common thing that people ask about, and frankly we pay close attention to in the hospital, it seems to last for about 3 days. So the paper masks that we wear and the paper respirators that we wear, we take them when we've used them. If they're contaminated, we put them in a bag for 5 days just to be extra cautious. And then we consider them sterilized and can be reused again. So for individuals who are concerned about coming in contact with infected paper like mail, my recommendation would be to put it in a paper bag, don't touch it for 5 days, and then it should be dead.
Wow. We have like a safe room when we go grocery shopping. We put it in the garage, and then I'm tempted not to go out there and get anything. All right, 747-0151, 747-0151. Thank you for your call. Go ahead, please.
Hi, thanks for doing this. Really appreciate it. Is the hospital safe to go to the ED?
Thank you.
So, great question. We have a fantastic emergency department who make sure that the #1 priority is keeping both patients and staff safe. So if you have an emergent medical need, you're going to get screened before you walk into our emergency department to make sure that if you do have symptoms of COVID, that you'll be moved to an appropriate area. And then while you're there, they're going to be using extensive protective measures to not only protect you, but to protect the staff. So if there's patients who have symptoms that are concerning for COVID, they're going to be put in a special clinical space so that it does not spread to other patients around them. The staff members you'll see are going to be wearing masks, pretty, either the sort of regular paper masks, the face masks, or the N95 respirators, depending on your symptoms, to make sure that they're not getting illness as well, and they're not spreading illness to other people. So the emergency department, both Todd Gregory, their medical director, and Tom Rounds have done a really great job making sure that we're keeping both our community and our staff members safe.
And I think it's important to add, Dr. Hildebrant, too, that we have not seen a transmission of COVID-19 to our staff or to other patients in the hospital. So I think that's one evidence-based outcome to say, we've done a good job of trying to contain this and protect our patients and our staff at the hospital. So I think you're probably safer coming into the hospital than you are going into some other businesses, because the people at the hospital, the clinicians, we've been doing this for 6 weeks kind of nonstop, and we have policies and processes and procedures to make sure we keep you safe. I think it's really important for the public to know that if you are not feeling well, if you feel you need to be at the emergency room, do not hesitate to go there. You are not going to be affected by doing that. As a matter of fact, you're going to put yourself in more jeopardy if you feel you have chest pain or shortness of breath and you avoid going to the hospital. That's why we've done all of this work to make sure that we're here for you and that we're safe for our community.
Amen to that. It's a COVID-19 update on all the stations of Catamount Radio and Public Education Government Television PEGTV. I'm Terry Jaye. I'm with Dr. Rick Hildebrant, Director of Hospital Medicine and President and CEO of the Rutland Regional Medical Center, taking time out of their incredibly busy day to answer your questions. And good afternoon. What question do you have?
My mother-in-law takes iron treatments and stuff, and I was just wondering about the Foley Cancer Center, if, like when she goes to the appointments, is she going to be okay? She's on oxygen too, so is she going to be okay to go get her blood work and get her, see her doctor there at the Cancer Foley Center?
Thank you for your call.
Great. So, again, the clinicians at Rutland Regional have thought through a lot of these questions, right? We want to make sure that anybody who comes into our doors is screened, first of all, and is going to receive the care that they need. So when your mom comes to the building, expect her to go through a screening process as she enters the door. You've likely heard that we are restricting visitors to the hospital except for those who are essential to the care being delivered. And then she's going to be able to receive the treatment that she needs in a safe manner. The staff all there are going to be wearing the appropriate protective equipment, and your mom is going to be wearing a mask so that she's she's not spreading virus or receiving virus from anyone else. But there's stringent protocols in place to make sure everyone's staying safe. We do have regular operations for those more urgent needs like iron infusions and blood transfusions, and many of the operations at the Foley Cancer Center that really you can't pause. So those protocols have been put in place, and your mom would be fine to receive care in the Foley Cancer Center.
All right. It's a call-in show. We depend on your calls today. 747-0151. Good afternoon. Go ahead, please.
Yes. I have read several different articles on the government virus thing, and there's several different opinions about the mask. One doctor says cloth masks don't protect you, paper masks don't protect you. The only one that protects you is something like a CD9 mask. I would like this explained to me.
Sure.
Do they protect you?
Thank you.
Sure. So as I had said before, this type of mask, which is a paper mask, a surgical paper mask, which you can purchase at many stores, is not designed to protect you from getting an illness. This is the type of mask that surgeons wear or nurses in the operating room wear to prevent the patients from getting their germs. So if we all wear this, if every person wears this, then people who have the virus will not spread it to others because they'll be coughing into this mask. The mask that's designed to protect healthcare workers is this one. This is the N95 respirator, okay? It's a very special mask that actually filters 95% of the particles that you inhale. So this is the type of mask that is designed to protect healthcare workers from getting ill. This is the type of mask that's healthcare workers or others would wear to prevent others from getting their illnesses. So yes, they work if everybody wears them, but they do not protect you individually from getting ill.
And Dr. Hildebrant, the other piece is they're not a substitute for social distancing.
Right.
So even though you might be wearing a paper mask, like Dr. Hildebrant said, we still need to practice social distancing.
All right, let's take another call. Good afternoon.
Yes, hello.
Go ahead with your question, please.
Okay. My husband and I returned from Florida and did the self-quarantine for 2 weeks. Did not develop the virus, thank goodness. But I was wondering if there would be a test that we could take to see whether we are carriers.
Great question. Thank you.
So the type of test that would determine whether or not you have been previously infected is an antibody test, okay? We do that in a variety of illnesses to see if you have immunity to those illnesses. A common one that we test for healthcare workers is for hepatitis. We check hepatitis titers to make sure that we're immune against those infections. There are many companies working on these tests. They're not FDA approved yet, and they're not widely available. The ability for those tests to be clinically useful is really late after you've gotten the infection, and they can be helpful for epidemiologists to determine what percentage of the population has got this illness. That type of activity is really going to be directed by the Vermont Department of Health. If they wanted to do a broad-based evaluation of Vermont to see what percentage of us have immunity to this, I would turn to VDH to really guide that process. That test, however, as I said, not FDA approved and really not widely available at this time, so I would anticipate it's going to be some time before we see that available.
Dr. Rick Hildebrant, Hospital Medicine Director and CEO and President of the Rutland Regional Medical Center, Claudio Fort, are on PEGTV and Catamount Radio. And good afternoon. Thank you for calling. What's your question today?
Can they tell us how many cases we have had of the virus here in Rutland and also in Vermont? And any have died?
Thank you.
Sure. So the Vermont Department of Health is a really great resource for all of that information. There have been a number of people that have passed away from the virus. I think last time I checked it was about 30. There's several hundred cases that have been positive in the state, and the number for Rutland County, I don't know the specific number, it's around 50 though. The good news is that the number of new cases every day is dropping. Okay, so that's one thing we look at really closely, is how many new cases do we have each day? And if you see that number increase every day, that's concerning, because that means that we could be exponentially increasing the number of cases in the community. We had a peak of those cases about 2 weeks ago where it was at 70 new cases in one day. And since then it has steadily fallen. In the last couple of days, it's been single digits of new cases per day, which again is really encouraging information. So that says we're doing the right things, the social distancing is working, and we got to stay vigilant, wash our hands, and stay out of the public so we can continue to decrease the transmission.
And if you want to check that out for yourself, it's readily available on the Vermont Department of Health website. You can find it at www.healthvermont, all one word, .gov. www.healthvermont.gov. It will give you a daily update of how many cases are in Vermont and how many cases are in Rutland County and how many deaths and so forth. All that data is there.
It's a COVID-19 update. 747-0151 is our number. Hi, thank you for your call. Go ahead with your question, please.
Yes, good afternoon. I'm trying to keep politics out of this, but my first is my compliments to you and the state for being so proactive. We're in a good shape because of that. But I'd like your opinion as experts in the medical and scientific fields. If we all want to go back to work, and since testing is not readily available to the general public, if everyone, individual and businesses, follows stringent health protocols such as the distancing, face covers, sanitation, would it be safe to ramp up certain businesses or industries, individual, small or large, at this time, especially with the warmer weather and outdoor work that could be done? Thank you very much, and keep up the good work.
Thank you. Thanks for your comments and your support. You know, I think that is certainly, I can't speak for the governor and the health commissioner, but I think that is top of their mind. I know they're looking at that on a daily basis, and they're trying to consult with experts, and they're trying to figure out what the best thing is for Vermont. It sounded like they might end up before May 15th if it's safe. As you said, depending upon the individual industry and the individual characteristics of that business, they might be making making some decisions about allowing those to open up and start back up. But we really are working with the governor's office and the Vermont Department of Health to take their lead on that. They are the experts. They're in touch with the other states along with the other federal agencies, and they're looking out for all the industries in the state. So I don't have a clear answer for that, but I think my opinion is Governor Scott and his administration, along with Commissioner Levine of the Department of Health, they've been very proactive, and I think they're going to try to get Vermont back to work as soon as they can, safely.
The other thing I would add, just to sort of one comment that was made, we have adequate testing available for symptomatic patients. The testing is really designed for people who have symptoms of COVID. Testing patients who do not have symptoms, the negative rate is high even when people actually have the virus. So we do not test those people because it just doesn't give you an accurate result. But if you have symptoms of COVID, call your doctor and ask to be tested, because there is adequate testing available both through the state. We use other external parties and hopefully in-house very soon.
We've thanked the radio stations, we've thanked the hospital, we thank PEGTV, but thank you to the callers. We've had some amazing questions here today, just fantastic. Go ahead, please, with your question.
Yes, my question is about testing. If the number of cases being reported is starting to go down, does that mean fewer people are having the COVID test? And if so, are test results coming in more quickly than they were before?
All right, thank you.
So we believe the reason the number of positive tests have gone down is that there's less people who have the illness, okay? Has there been less tests done every day? Yes, there has, but there's also been less people who are sick with the illness to present for testing, because we only would test someone who has symptoms. The availability, we have plenty of availability of testing. We use, again, a couple of different partners. It's either through the Department of Health. Some of our tests will go out to the Mayo Clinic, and some of our tests will go out to Dartmouth-Hitchcock. Depending on the specific patients, the inpatients will go one place versus outpatients. And again, the testing availability hasn't been a barrier. It really seems likely that the overall burden of illness is decreasing. Another number that is on the Vermont Department of Health website is the number of actively hospitalized individuals with COVID-19. And that's a really important number because it looks at how many really sick people do we have in our state. That number's also been going down pretty steadily. So that's another encouraging sign that the overall burden of this illness is decreasing.
COVID-19 update, and let's take another call. Thank you for your call. What is your question?
I'm in a high-risk group in that I'm 78 years old, have heart failure and emphysema. I have heard of the drug hydrochloroquine, and I was wondering, is there anything like that or that drug itself that I might use either as a prophylactic, or if I ever do get the disease?
Thank you for your call.
So I would strongly recommend you talk to your primary care physician about what the right medications are for you for your specific illnesses. There is no prophylaxis for this. There are very smart individuals working on a vaccine. A vaccine is the prophylaxis. That's the same kind of thing we use for the flu when the flu comes around. And if we do see a vaccine, we will certainly advocate for individuals to get that as appropriate based on the recommendation of your medical professionals. But there is no prophylaxis outside of the thought of a vaccine in the future.
On that topic, we should try to stay healthy anyway. Eat right, exercise,
Absolutely.
Take plenty of fluids. Am I on the right track?
Absolutely, and staying healthy and having a healthy immune system is one of the best things that we all can do. So if you have a chronic illness, making sure you're staying on top of your chronic illness, taking your medications as prescribed by your doctor. If you don't have a chronic illness, staying healthy, exercising, eating right. That's really hard nowadays. There's a lot of information going around on quarantine time frame that people's diets have been quite bad and the exercise has gone out the window. Continue to exercise, sleep well, eat well. You know, all these things can be very, very important in keeping your immune system healthy so that you can fight this virus in the case that you do contract it.
And I would add to Dr. Hildebrant, also take steps to stay mentally healthy. This is a very stressful time. And I want the viewers to know that there are a lot of great mental health resources available to us in our community. We have great people doing this work. We have great capacity for us to do this. That is a service that can be very easily and very well done through telemedicine, counseling or behavioral health visits. So please, if you're starting to feel really anxious, if you're starting to feel like you are having a couple drinks and you have to have those every night to relax or unwind, please don't hesitate to talk to your doctor, get a referral to a mental health clinician, and talk to someone. I think it's really important to protect not just our physical health, but our mental health and well-being during this incredible time.
By the way, radio announcers are filled with all kinds of nonsensical trivia. The #1 family complaint, living in close quarters with your family, the #1 complaint, and I can't believe this is the answer, people chewing too loudly. I got to throw that in. Good afternoon. COVID-19 update. What's your question?
Yes, the question's for the CEO of RRMC. As a concerned citizen, they laid off 150 people, and yet now they're hiring more people. I just don't understand why you would lay off people you already have working for you, then hire other people to replace them.
Yeah.
Thank you.
Yeah, thanks for that question. So we didn't lay people off. We put them on furlough. We put them on unpaid furlough. So we are continuing. They are employed by the hospital. They have full health benefits, and we're paying for even their portion of their health premiums because we want to keep them well during this time. And we've helped them access the federal enhanced unemployment benefits. So we think we've done a good job to try to take care of them. And the reason why we put them on furlough is a couple things. One is we wanted to get them safe and out of the hospital and practice social distancing if they didn't need to be there. But the real reason is we just don't have the work for them to do. A lot of these folks were administrative staff who worked in back office functions in some of the practices, and because our volumes have been down, they don't have enough work for all of them. Now we are hiring people. We are hiring clinical people on the front lines. And some of those people from the practices, like medical assistants that could have taken you and roomed you and taken your vital signs and so forth, we've taken those people and tried to reassign them. They're now screening people when they come into the hospital and taking their temperature and so forth and doing that. But we are looking at hiring nurses or other clinical staff where we might need those now and also in the future. So we are in hopes, as we start looking at the kind of reconstruction period, to take some of these people and get them back to work as quickly as we can.
All right, thank you. And we understand, before we even went on the air today, we knew we were going to talk about that today, and that's an important concern, and thank you for addressing that. You have a question there, Dr. Hildebrant. I'm not sure I understand where you want to go with that.
Right, and the question here is, of the cases that are in Rutland, are they being treated at RMC? So, as a healthcare provider, one of the most important things that we do is provide patient security. We don't want to divulge patient information to anyone. That is not our job. Our job is to take great care of patients and their families, right? The Vermont Department of Health, they have a different role. They can disclose patient information as they feel it's important for public health reasons. So they're really the only agent that would disclose that type of information as to what patients are where and how they're being treated and who they are. And that has been reported in a number of different cases. But we're not the kind of organization that's going to divulge patient information. We keep that very confidential. We want to respect everyone's privacy, and we do that with every single person that we have.
It's a COVID-19 update on PEGTV and all the stations of Catamount Radio. And your questions are wanted today, and we know you have them. 747-0151, 747-0151. If you tried to get through earlier and the lines were busy, we have a couple of open lines right now. Hi, go ahead with your question, please.
Yes, thank Thank you for taking the time. I appreciate it very much. I was curious, will the alternate care sites be used for patients outside of Rutland, like, for example, overflow from New York?
Oh, okay. Thank you.
So, yes, those alternate care sites are for the southern Vermont region, and we're coordinating with the State of Vermont Department of Health and the Emergency Management Agency so that they have the capacity and we have the capability of taking care of, they're kind of a regional site, not just for Rutland County, but also maybe down to Bennington and so forth, if they need them. Now, I don't know about New York. It's a good question. You know, I think certainly for Vermonters and certainly for the southern part of Vermont. I'm not sure if we had, you know, I think if our colleagues and our friends and neighbors over in New York, if we had the capability and the capacity and they needed it, I think we would work to try to help them out as well.
Okay. We have a question that someone called in. Does it matter what kind of soap you use? We always hear washing your hands is better than the sanitizer, so is there a secret soap out there?
No, there's no secret soap. So there's, broadly speaking, two different types of soap that you can buy. There's antibacterial soap, and then there's non-antibacterial soap. This is not a bacteria, okay? So an antibacterial soap is not necessarily going to be any more effective than a regular soap. And really the way soaps work is by mechanically dislodging things from your hand. So a regular old soap without any antibacterials in it will work perfectly well. Make sure you're washing your hands appropriately, though. Most people do not. They wash their hands for a few seconds and then they're done. 30 seconds of hand washing is what's required, and you need to make sure you wash every aspect of your hand when you're using the soap. There's some very good resources online on how to wash your hands appropriately. I would encourage you to look at those. A good analogy I've heard is, this is a meme from a few weeks back. Imagine that you are cutting up some jalapenos for nachos, and then you have to change your contacts out. So use that degree of diligence when you're washing your hands to make sure that you're appropriately cleaning them.
I like that way of thinking better than my way. I was singing the Baby Shark song for 30 seconds. And that did not work. It's 747-0151. Thank you very much for your call.
Hello.
Hi there.
First of all, let me say, regarding the last question, a ladies' manicure specialist informed me that for those of us who wash our hands too many times, and we have to, we know why, that one can use Dove soap because it has a moisturizer in it, and your skin is less apt to get dried out. That's not my question, but
thanks for the tip.
I'm just throwing that out.
Thank you.
Now, my question is, I'm a disabled senior citizen, and I have someone who mows my lawn. It's not a company; it's a private person. And as we know, the grass is going to grow here, and it won't stop for anything. So when can those people come back out and do that job safely?
Thank you for your call.
Yeah, that's, you know, respectfully, that's really not our call or kind of what we would weigh in on for the hospital. I think we would defer to Governor Scott and his executive order. And I think he is, from what I hear and understand, I think they're looking at that very closely about when we can get certain industries and certain folks back to work as soon as possible.
Yeah, great question, though. It's 747-0151, 747-0151, and thank you for your call. What is your question, please?
Hi, it's my understanding that the hospital promised nurses extra pay for working on the COVID unit, and nurses volunteered and were given extra pay, and then it was taken away. It's my understanding that they were told it was for budgetary reasons, because everybody who works at the hospital is potentially exposed. If it's for budgetary reasons, I want to know why traveler nurses been hired that are making over 5,000 that don't even have to work in the unit. And if it's the other reason that everyone's being exposed, why don't you rotate other doctors?
All right. Thank you for your call.
Yeah, I didn't quite hear all of your question because you were cutting out a little bit, but my understanding is the question was, did we start paying enhanced pay for some of the people who were working, some of our nurses and our frontline staff who were working on the COVID positive unit, and why did we discontinue doing that? Was it for budgetary reasons? And yes, it was for two reasons, kind of budgetary and equity reasons. Because our volumes and our revenues have been down 60% for this month because of all the things that we did to protect our staff and our patients and make sure we're able to be open there in case we get critical care patients in. Our revenues have gone down significantly, and we've, like all hospitals, have experienced some significant losses. And so when we looked at what we were able to do for our staff, just about anyone in the hospital, from the front door screeners could be in contact with a COVID positive patient, to certainly our housekeepers and our phlebotomists, our drug people who are drawing your labs out in the tents. So any of those could have been exposed, and we really would have ended up having to pay just about everyone enhanced hazard pay. So we decided, and we talked with some of our staff and our leaders, and we said we just couldn't afford to do that at this time. And we took some other measures, including some salary reductions of some of the higher earning staff to make sure that we're going to be able to weather the storm financially and make sure that we have our best shot for putting this back together.
Thank you for answering that question. We've got about 7.5 minutes left. If you've been waiting to call in, now's the time to call 747-0151. Good afternoon. Thank you for your call. What is your question, please?
Hello?
Hi there. Do you have a question?
Hi, how are you?
We're doing well.
What was that? Sorry.
Go ahead with your question, please.
Okay, so my question is, first of all, I'd like to thank all of you for doing everything you're doing and trying to manage this. It can't be easy. So my question, and hopefully it hasn't been answered, is what's next? So assuming we get back to normal and life moves on and we're allowed to start integrating back into our lives as they were, the best we can, and then there's an influx again in sickness. What are the preparations and safety nets put in place to kind of, A, combat that, and the backlash that's going to come with it?
All right. Thank you. Great question.
So this pandemic will have fundamentally changed medicine as we know it. In many ways that we've already talked about, so telemedicine is a tool that we now have, which we'll always have. The facility is going to have to change. Our hospital will have to change. One of the things that we identified early on is that our capability of what we call negative pressure rooms is limited. Our capacity is actually greater than most of the facilities in the state. We still don't have enough. So our leadership team has been in discussions with our facilities folks to say, how can we change this so that when the next virus comes, we're prepared? Because if it's not COVID-19, it will be another virus, and we need to change and prepare for that. Another thing that we've talked about on the show is testing. Testing we've been pushing our lab partners from day one on this, and I think they heard the message. We want testing fast. We want 5-minute tests so that we can know whether someone has COVID or not on the front end. And whether it's COVID or it's the next pandemic, we're going to want the same thing. We want immediate point-of-care tests available to our patients. Our PPE stock. So a lot of news stories around the filter masks, right? And that we don't have enough of those. We used to keep a par supply that was enough for normal operations. I don't think any hospital in the country is going to be doing that anymore. We're going to be stocking PPE for a pandemic, right? So that if we do come into this scenario again, we've got adequate resources to protect our staff and our patients. And another thing that we have focused on in the past that we realize how important it is because of this is how important it is to work with our community partners. We have worked closely with other hospitals such as UVM, with our primary care physician colleagues, through community health and other places, through our visiting nurses, through our nursing facilities. We have to all be reading from the same playbook and have very coordinated care so that we can make sure that every patient gets the care that they need in our community. And those are some really important things that we've already taken out of this and is fundamentally going to change the way healthcare is being delivered in the future so that we can be prepared for this.
All right. Thank you. We have time for, we're going to try to slip in as many calls as we can, and then we're going to wrap things up. Thank you for your call. Go ahead, please.
Oh, hi. I noticed that a lot of people are buying disinfectants to clean hard non-porous surfaces like countertops and stuff like that. And people have been buying antibacterial things, though this is a virus. And so they say, oh, look for particular products that say they address both viruses and bacteria. I also noticed that the EPA has a website where you can actually type in the particular company product, and it will tell you if the EPA does say this is something that they say does address the human coronavirus or just the rhinovirus, which is the especially common cold, or just bacterial in general. Have you found that people have been using appropriate or non-appropriate products for doing general household cleaning? And would you recommend going for a particular product or going to the government's website and doing like a bleach and water mix?
All right. Thank you for your call.
Sure. So I don't really know what our population has been using to clean, but I can say that bleach-based products are really the biggest recommendation we have. The hospital uses very specific cleaning protocols for patient care areas, but in your household use, bleach-based cleaners are always going to be the best type of cleaners. It will kill pretty much anything out there. Of course, you can see which products have bleach in it by referring to a government-based website.
All right. This is our last caller, and thank you for your call. Do you have a question, please?
Yes, sir. I was just wondering when the vaccine would be available and if they are testing for it right now. I heard they were. I wasn't really sure.
All right. Great question. Thank you.
So we don't know when the vaccine, if and when the vaccine will be available. We hope soon, but we don't know the answer to that. And then in terms of the antibody test, they're not FDA approved, and they really haven't gone through that rigor to ensure they're ready for prime time use yet. So they're not widely available at this time. Again, hopefully they will be in the coming months.
Claudio, the last word is yours. Claudio Fort, you want to address people, give them some interesting information that they need.
Yeah, thank you, Terry. It's been almost a month since Governor Scott issued his stay-home order, and the prospect of continuing this lockdown for another month seems daunting. So I want to share with you some words that have inspired me during this. I have compared this situation to a war, and I've been reading the speeches of one of the heroes of our last World War, Winston Churchill. In the fall of 1941, while in the middle of World War II, the Prime Minister went back to his alma mater, the Harrow Military Boarding School, for a sort of homecoming where he addressed the student body in one of his famous speeches, where he exclaimed, "You cannot tell from appearances how things will go." Churchill then reflected on Great Britain's situation over the past 2 years that they were at war. This was about 6 weeks before the Japanese attack on Pearl Harbor brought America into the conflict. Churchill appraised the situation, stating, "But can anyone sitting here this afternoon, this October afternoon, not feel deeply thankful for what has happened in the time that has passed and for the very great improvement in the position of our country and of our home?" He went on to say, "We had the unmeasured menace of the enemy and their air attacks still beating upon us, and you yourselves had had experience of this attack. And I expect you are beginning to feel impatient that there has been this long lull with nothing particular turning up." Churchill then issued these words of caution. But we must learn to be equally good at what is short and sharp and what is long and tough. It is generally said that the British are often better at the last. They do not expect to move from crisis to crisis. They do not always expect that each day will bring up some noble chance of war, but that they very slowly make up their minds that the thing that has to be done and the job put through and finished, then even if it takes months, if it takes years, they do it. But for everyone, surely, what we have gone through in this period, I'm addressing myself to the school, surely from this period of 10 months, this is the lesson. Never give in. Never give in. Never, 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 never. In nothing, great or small, large or petty. Never give in except to convictions of honor and good sense. Do not let us speak of darker days. Let us speak rather of sterner days. These are not dark days. These are great days. The greatest days our country has ever lived, and we must all thank God that we have been allowed, each of us according to our stations, to play a part in making these days memorable in the history of our race. Winston Churchill, October 29th, 1941, the Harrow School. Thank you.
For PEGTV and Catamount Radio, I'm Terry Jaye. Stay safe.